never seems to stop. And to break down this week's developments and to answer our questions, epidemiologist Dr. Raywat Deonandan joins me now. Thank you for joining us, Doctor.
Thanks for having me.
Okay, so across most of the country, we've seen COVID-19 infection numbers on the rise, along with hospitalizations and cases in the ICUs. I just want to know your thoughts if it's still possible to win the race between vaccines and variants. We've heard differing opinions as to whether it's a losing race. What do you think?
I think we're going to have a couple of rough weeks for sure, but we can always win the race if we really ramp up vaccinations significantly. Do we have the political will? Do we have the vaccine supply? Do we have the public will to receive vaccines? Those are unknowns. It's going to be close. At the very least, we're going to win eventually. Sometime this year, we'll get ahead of that curve. But in the short term, the third wave is upon us, and it's going to be kind of rough.
You talked about the will to get vaccinated. The City of Toronto announcing 30,000 vaccination appointments available for next week. So it seems like there's more supply than demand at this point. Is there anything the province can do or anything you can recommend to get these spots filled?
We need a widespread education campaign. Part of this is fear of the AstraZeneca shot due to, everyone knows the various kinds of news coming out of Europe. So we need a full court press on understanding risk versus reward. The risk posed by vaccination is minuscule. The potential reward is significant because COVID is real, and every minute we spend being unvaccinated, we're at risk of infection, therefore at risk of suffering and death. So that simple metric has not been well communicated yet, and we need to really try harder at the communication side of things.
In one Toronto neighborhood, Scarborough, residents 50 and older with chronic health conditions, as well as anyone living with a developmental disability, they're getting vaccinated. Do you think this criteria should be rolled out more widely?
It makes sense to do this on a region-to-region basis because every region has a different load and different infrastructural demands and different capacity for healthcare. So, on the whole, though, how we define risk is important. You define risk in terms of the likelihood of hospitalization. You can define it in terms of the likelihood of infection or the likelihood of exposure. It depends on what you're trying to do here. Are we trying to keep the healthcare system up and running, or are we trying to curtail the spread of the disease? Depending upon the goal, that will determine the deployment strategy you embrace.
Okay, we are hearing the Premier and Health Minister are holding a press conference shortly, and that there's a possibility of easing restrictions in Toronto and Peel regions. So when you hear that in conjunction with the past few days' case counts of 2,000 plus, what do you think?
I'm thinking that's poorly timed and not playing the long game. What we're trying to do here is to keep spread as slow as possible so that we can vaccinate ahead of the curve. That is not accomplished if we're opening up opportunities for greater transmission. I think it's an ill-advised strategy, but there are other voices around the table, not just the epidemiological voices. There are economic voices, mental health voices, and so forth. I just hope that public health takes prominence in these discussions.
And finally, there's a growing number of vulnerable people who have been vaccinated. What's your advice to those who have received their shots? For example, the question keeps coming up, can you hug your grandkids or have people over for dinner?
Right, so vaccination is just a mitigation tool like mask wearing or distancing. It's just a very good mitigation tool, but it's not perfect. There's still a very small probability of becoming infected or passing infection on to somebody else. So two vaccinated people hanging out together is a very low risk because the probability of moving infection is small. One vaccinated person with another unvaccinated person is a slightly higher risk. All of this is confounded by the rate of transmission in the community. So as long as the rates are high in the community, the risk remains relatively high. So this is ultimately a personal choice. My feeling is so long as we are experiencing very high rates of incidence in the community, we should be a little more circumspect. However, if your mental health needs demand it, then I think vaccinated people should be feel free to interact with a bit more freedom.
Okay, thank you again for your time. That is Dr. Raywat Deonandan.
Thank you.
As spec-
And you're clear, doctor.